Well, thank you for joining me tonight. I'm here to talk about local NGOs in Cambodia, and I'll introduce myself. My name is Tony. I'm a trauma and ICU nurse and have been for nearly 23 years. Recently, I've had a number of trips to Cambodia in Southeast Asia, probably one of the more poor countries in Southeast Asia, probably um, more related to Laos than Vietnam in relation to poverty. And during my time there, I spent some time working at what we call local NGOs or local non-profit organisations as a medical nurse. And during my time there, I was employed at a local NGO, which was started by a couple of American doctors, which was specialised in orthopedics and ophthalmology. However, most of our work was orthopedics, and I'll explain a little bit about how the system in Cambodia works as compared to more Western countries, more Australia than anywhere else. And so in Cambodia, there are three levels of healthcare. There are private, public, and profit or clinics that are set up across Phnom Penh and Siem Reap and other provinces across Cambodia. The problem with the public health system in Cambodia, obviously, is that it is not a free system, even though if you are injured, you will be taken to a public hospital serious enough. However, diagnostic investigations such as MRIs and CT, things like that, are not for free. So many of people who are involved in trauma, especially road trauma, which is a huge over there, not to attend hospital based on the cost. The average daily intake or income for someone in Cambodia is usually between $2 and $3 US, which is very, very little. So it's probably enough for them to eat and to survive for a day. So it's a subsistence living, you could say. And many of them work in professions where they will not be making enough money to barely feed their families. So healthcare is something that is not seen as an important factor in their livelihood. So is that in Cambodia there is a large amount of rural population that live outside of the major cities of Siem Reap and Phnom Penh. And a lot of those individuals that live in these areas are extremely poor and usually farmers. So a lot of the injuries that we saw were orthopedic injuries. Some of these injuries are extremely serious when we talk about in Western medicine. And some of these patients would put up with these injuries for maybe 6 to 8 months. In one particular case, I saw a lady with a fractured radius and ulna with compression, was going into compartment syndrome, completely displaced right arm, who continued to work on her farm, no longer tolerate the pain. And so she had to go into this NGO clinic because she couldn't afford public or private healthcare. And so in this NGO, we were able to repair the arm, but we were working with very, very basic equipment, very basic anesthetists and ventilators, very basic antibiotics. The other issue for me was the serious road traumas that happen in Southeast Asia. As you can, Many of you have probably seen footage of Vietnam, Laos, Cambodia, where driving traffic lights, driving on the right side of the road, it's just a suggestion. So there's a rhythm that they have in driving. However, road trauma is quite prevalent. And so trauma and ICU medicine in Cambodia is very limited to the poor. If you're rich enough to pay for it privately, that's fine. In the public system, as mentioned earlier, any diagnostic tests that require x-rays, MRIs, those sorts of things, CT scans, need to be paid for. So anyone involved in road trauma usually will not go to hospital. Unfortunately, I was involved in a couple of road trauma accidents, not myself personally, but I was there when it happened. So even the education of the first responders is extremely poor. So the medical education there is not quite at the standard of what we would consider Western standard treatment, first aid treatment. And so it can be quite disturbing as a healthcare professional to witness these sorts of things, but also witness these local NGOs or non-profit medical centres work with some of the most basic equipment that you could possibly imagine. So we were working with anaesthetising machines that were 30 years old, with syringe drivers that were over 30 years old. We had forceps and scalpels which were sterilised over and over again. We had basic antibiotics. Some of the antibiotics we were using were, doxycycline, amoxicillin, even for the most basic stuff. Anything like gentamicin or vancomycin was non-existent. So it was a very, very confronting situation for me personally as a health professional to work within that. However, it gave me a perspective that the world is a cruel place, and we're very lucky to live in a country where we can afford free healthcare. And so what I'm doing is it is now come to me that we would like to start a non-profit NGO in Cambodia, which specializes in road trauma and specializes in traumatic events. NGOs which deal with orthopedics and things like that. And so this is why I'm putting this video together, just to give you some idea about the situation in Cambodia at the moment. Now, Cambodia is a country that is on the rise economically. However, 80% of the population over there are still extremely poor. They're making $2 to $3 easy a day to live on, and so the chances of many of these people being involved in accidents and things, going to hospital, is just not an option. And so this video is just to introduce you to some of the situations and the reasons as to why we would like to start this up. So starting a local NGO or a non-profit organization in Cambodia is quite easily done. It is not as bureaucratic as somewhere like Vietnam. However, of course, with anything that involves these sorts of things, we need donations, and mostly the donations that we require would be medical equipment. So any bandages, anything medical, pills, antibiotics, out of date, doesn't matter what it is, forceps, anything that you could possibly think of. These are the sorts of things that we are going to be requiring for our work, especially things like lignocaine and anesthetics and things like that. If you're a trauma nurse or a trauma physician, you would understand the sorts of things I'm talking about. There's no such thing as neck bracing over there or immobilization. So a lot of the things that we do when we assess someone for trauma is based on skills rather than diagnostic imaging. which is very limited. The only diagnostic imaging that we do have is X-rays, but in most time those X-rays need to be done prior to their presentation. So I'm going to add a few things to this presentation to show you some of the injuries that we did that I did work on, and that maybe give you some idea about the work that's needed and the ideas that we have. We'd like to try and have this up and running within 6 to 8 months. And so obviously I'd like you to learn about it. We will be starting up a GoFundMe. We've already raised a certain amount of that, $7,000 so far. We've had 2 prior trips already. So we're already getting ready to look at premises and setting up. We've also had some interest from other nursing staff in Melbourne who would like to come over to work on these sorts of things, which gives also a great benefit for anyone involved in trauma or ICU nursing or any sort of that sort of nursing or that sort of medical field, because it really sharpens your skills, because you're not using the equipment that you would normally use. You're really using the skills that you've acquired over the time as a nurse or a doctor. Of course, with any of these things, working as a volunteer, you don't need to be registered as a nurse over there unless you expect to be paid or work in a public hospital. So these things can be done quite easily, but it's just up to you whether or not it's something you wish to do. In the world that we live in at the moment, we live in a Western world where, yes, we have a lot of advantage, but there is still a lot of disadvantage, especially on our doorstep. When you think about Southeast Asia, it is very poor and undeveloped, and it's something I think that we should all really think about, because it is, without this sort of intervention, these people will not be able to survive into the future and thrive. So I'm going to add a few bits and pieces to this video, and I'll edit and I'll present it, and we can see some of the things that that I witnessed.